When ABA therapy falls short, it can feel like you've run out of options. Maybe your child's therapist isn't a good fit. Trust your gut. You're not going crazy. You, as a parent, you know your autistic baby best. There is an alternative, so you can implement session just as good, if not better, than the therapist. My name is Celeste. I coach and empower parents on how to better connect with their autistic baby, how to really get in their world and teach meaningful everyday skills. And today we're talking about ABA, its limitations, and what you can do when it falls short. The whole motivation behind this video is to inform and empower you as a parent to make the best informed decision. The goal is to inform you on what ABA is, what it's not, so you go in with a realistic expectation. My hope is that you can decide whether ABA is a good fit for you or if it's not a good fit for you, because honestly, both of those decisions are valid. And we want that decision to come from an informed place. Parents have an unrealistic expectation that their one-to-one therapist is a very seasoned and experienced clinician. That's not the case, nor is it in their job description, okay? These one-to-one therapists don't have seasoned, superb clinical skills. Why? Because it's not required. Their role as a one-to-one therapist is to carry out the programs that their supervisors have put into place. So sometimes parents will ask questions to their one-to-one therapist that should be directed to the supervisor. For example, we're having a really hard time with transitions. What do you recommend me to do? Do you have any ideas? If the therapist is not experienced with transitions, and if transitions is not a specific goal written in their program that the supervisor trained them to do, they're not going to have the clinical skill set to be able to answer their question. Again, nor should they. Their job is just to carry out what they've been trained to do and what's in your child's program, and nothing new. New things will be proposed and developed by your supervisor. Let's talk about the different roles in ABA. So first, there's you as a parent. You play a vital role that is irreplaceable. If parents are unable to pull their weight, our ABA program is going to fail. So in California, depending on your insurance, ABA exists in a 3-tier model. So there's the one-to-one clinician, the one-to-one therapist, there's a master's level clinician, and on the very top is a BCBA, the Board Certified Behavior Analyst. Let's talk about the therapist role. The therapist role is really an entry-level position. It's very frequent that the training is very brief. Let's talk about the MA role, the master's level clinician role. This clinician is in progress or already has their master's level education. They're typically experienced in the field of ABA, and they report directly to their BCBA supervisor. The master's level clinician can, for the most part, answer those clinical questions that we talked about earlier that parents may have, depending on their experience and clinical skill set. What's the BCBA role? The BCBA role is the highest level of certification or education that you can get in the ABA world. As a BCBA, they're the ones who are going to be developing goals for the child, supporting and educating the parent, and really have a robust clinical skill set across multiple areas. Your BCBA may have expertise in specific areas. Like for example, my specific areas are behavior support, communication, toilet training support, and sleep support. And it's going to vary on your BCBA's experience and education. So now that we reviewed the team, there's parent, and then there's the 3 clinicians on your team. Why is this important? It's important because the one-to-one therapist does not make clinical recommendations. They don't make goal revisions. In addition, one-to-one therapists are not typically long-term. In the field of ABA, retention is low, sadly. I made a whole video on the reasons why. It's called The Hard Truth Every Parent Should Know About ABA in 2025. Watch that if you want to learn more of the drawbacks of the system around ABA in California, at least. The takeaway is one-to-one therapists are not typically long-term. Sometimes parents have an unrealistic expectation that a therapist is like a kindergarten teacher. You see the child on the first day of school, and typically the kindergarten teacher lasts until the last day of school, but ABA therapists aren't like that because retention is so low. You're likely to have the same therapist for a few months and then transition to a new one. And that can be frustrating as a parent because you're like, oh, we spent weeks or months on and time really invested in this person, and my child really made the connection, and now they're leaving. And then progress is halted. As a clinician, it's my goal to transfer all of the skills that work for your baby to you and really bulk up your skill set. So when you see that tantrum building up in real time, you know what to do with fluency and confidence. My goal is not to make you dependent on me, not to make you dependent on the one-to-one therapist. My job is done when you say, well, you know what? Thank you, Celeste and your team. I really don't need you guys anymore. Like, I've learned a lot from you guys in the past few years, and I feel ready. I feel like I've learned all I can learn, and I feel confident. I've put in the work. I've done the practice. I'm ready for graduation. I'm ready for the next step, which is essentially services fading out, right? The goal is to make you independent of me, right? Not dependent on the services. Because when you first start, yes, you're going to need a lot of hand holding, and I'm here to hold your hand. And we are not taking off those training wheels in the very beginning. But over time, we're slowly getting our feet wet. And by we, I mean you as a parent, like me instilling those skills in you so you can implement session just as good, if not better, than the therapist. Because honestly, parents, I don't say this to make you feel better. I say this because it's true. The skills that the therapist is implementing with your child is not that hard. Like any skill, yes, it takes time, and we're going to meet you where you're at. For example, let's say, parents say, I really want to work on reducing tantrums. I see a lot of tantrums when I tell him it's time to clean his room, but I need him to clean his room. He's 7 years old. There's screaming and throwing things, a lot of frustration, sometimes aggression. So I just avoid it altogether. ABA comes in and we hear this concern and we're like, oh, okay, let's start modifying his environment, okay? That might mean introducing picture icons like visuals to let the child know what to expect. We might propose using a timer, so letting the child know when cleanup is going to happen. We might even want to start by reducing the amount of toys he has to pick up to really give him that momentum. And we might offer choices like, do you want to start by making your bed, or do you want to start by putting your shoes away, right? Giving the child that control. Let's go back to the cleaning up example, right? It's possible that the child will master the cleaning up skill, will have almost no tantrum behaviors when their therapist asks them to clean up their room. But if the parent hasn't practiced that skill with the child, and the child is only able to clean their room with a therapist, and not when their mom or dad asks, not when mom or grandpa asks, or not when the babysitter asks, is it really mastered? Does it even matter? I would argue no. First is trust your gut. You're not going crazy. You as a parent, you know your autistic baby best. You know how they learn, you know what triggers them, you know what sets them off, you know how they thrive, you know their learning style, you know them best, okay? So trust your gut. And first I'll say, bring the concerns up to your supervisor and give them a chance to remedy the situation. This especially applies to if you have a grievance or a concern about your one-to-one therapist, Bring it up to your supervisor. But let's just say you already did that. Let's say you already did that and it's still not working. Really, there's only one solution that empowers you, the parent, to have your baby's learning in your hands. And that is parent training. Parent training is basically when you remove the one-to-one therapist and it's just the supervisor and the parent working directly together, coaching and really beefing up those clinical skills so that way the parent knows what to do, knows how to manage behaviors, knows how to teach new skills and have them stick over time, over long periods of time. I'm getting chills just talking about this. Like, this is super powerful. Let me tell you a story, okay? I started in the field over 10 years ago and I was a one-to-one therapist. And, after a few years of experience, I had a good amount of tools in my toolbox. My clinical skill set was sharp, okay? And I remember one day I was working with this little boy and his mom. I had been working with him for a few weeks. We were sitting at his little child table. And I was sitting in the little plastic chair and the mom was too. And the little boy was playing here. He was on his break. And the mom just looked at me. And she's like, wow, he really listens to you. And she kind of chuckled and she was like, he doesn't listen to me, but that's good that he listens to you. And you know what? At the time, I'm going to be honest, at the time, I felt kind of proud. I felt like, wow, my skill set is really good, but I wasn't doing that parent any favors by not transferring those skills over to her, by not teaching her how to do the same things I was, because it wasn't anything magical or special or extraordinary that I was doing. Any parent can learn these skills. I don't care if you are a doctor. I don't care if you don't have a high school diploma. Any parent can learn these ABA skills. With a supervisor who knows how to teach, anyone can learn these skills. So at the time, I felt like, wow, I'm really good at what I do. And looking back, that story keeps me up at night because I could feel the sadness in her voice. She has the right to feel that confidence and that empowerment to be able to connect with her son and teach him new skills. Because isn't that what every parent wants? At the end of the day, when your one-to-one therapist goes home, it's your right as a parent to feel competent and ready to manage any behaviors that may come your way. And if your team did their job right, you should have that and no one will be able to take it away from you. So if you're currently getting ABA, ask your supervisory team about parent training. On the other hand, if you're currently on a wait list for ABA, call them and ask them, hey, is there a wait list for parent training? I'm ready to start now. And sometimes they'll be able to accommodate if there's a supervisor available. Because you don't need a one-to-one therapist, right? If you're on a wait list, it's likely they're waiting on the therapist. To recap, when ABA falls short of your expectations, parent training becomes a powerful alternative, one that equips you, the parent, with the tools to support your autistic child effectively. The mere fact that you're here on YouTube searching for answers shows your eagerness to learn. You take initiative. You want to put in the work. You want to learn the skills. You want to make long-lasting, impactful change. You want to be in the driver's seat of your child's learning. You're ready to build new skills. Because deep down, you already know that you are your child's forever teacher. From your favorite BCBA, you got this.